Hello, everyone. Good to see you all. We're going to make a really prompt start today, not least because the intros take a while, so it gives latecomers a little bit of opportunity to get onto the call. So today's webinar is all about compliance. So we will talk a lot about CQC, but we are making this very, very applicable to the other regions of the UK as well. I think this is our biggest webinar today in terms of the number of people that are contributing to it. So we have Georgina from Inspired for Health. I'll have a proper intro slide in a moment. We've got Dave from MOA Benchmarking, and we have Merina from CareLineLive. So there are logos, so you can see them there. Pictures of those individuals and their LinkedIn. So do follow them all on LinkedIn. For those that are particularly eagle-eyed, you may notice that Merina has had a job title change. She's moved from home care champion to home care sector specialist, which we felt better describes what she does. So super, super happy to have Georgina and Dave with us today. Georgina being a kind of expert on compliance, does a lot of training for providers in this space. And we came across her and said, you know, why don't you do a little kind of whistle-stop tour of compliance for us for a webinar. Before I go on to any more detail, we are recording this. We won't be unmuting you, so if you have any questions, please just pop them in the chat thread, ideally the chat thread and not the Q&A thread. I may or may not interrupt people as we're going, because we're likely to just pick up Q&A at the ends of different sections or right at the end, because we've obviously got quite a lot to get through today. And we will send you a link to this recording, and we'll also send you the slide decks as well. So I'm Marie Page, I'm the marketing manager at CareLineLive. So CareLineLive, just for a very quick intro to us, if you're not aware of us, we are an all-in-one home care management software. We have over 700 customers in the UK and elsewhere. We are on the NHS Assured Supplier List. Three main aspects to our software: the provider platform, the Carer Companion app, and the Care Circle portal. Our thing is that we're very much customer focused, so we answer the phone normally within 20 seconds max, and we are people that are behind this software, and we very much care about the people that are delivering care for service users. If you join us, you'll find that we just charge one flat rate price for our system. There's no hidden extras, there's no additional costs. It's all nice and transparent. Okay, I am going to hand over to Merina. I'm going to drive the slide deck, and Marina's going to start off by talking about some research that she's been doing recently, which has ended up all being written up in a new ebook. We'll give you a link to that. In fact, Natalie will probably pop it in the threads as well, but I will hand over to her now.
Hi everybody, thanks for joining today. Thanks, Marie. So our new ebook is called From Confusion to Confidence, and it's all around conquering compliance and home care. So what I've done with this ebook is I didn't want to just do England, because we have customers not just in the UK, but we have customers all over the world as well. And you know, the regulatory organisations do vary a little bit, but in essence they're sort of fairly similar. So the ebook does cover the Care Quality Commission, which is the regulator in England. My very favourite is the Care Inspectorate Scotland. I really enjoy, and actually the Care Inspectorate Wales, and we do cover that. And the Regulatory and Quality Improvement Authority in Northern Ireland. And also we're covering the Jersey Care Commission. And you might wonder why we're covering the Jersey Care Commission. And that's because we have a lot of providers in Jersey using CareLineLive. And, you know, I'm a very big believer in that we all need to learn from each other, and use our collaboration skills to do that. So what I will say about the regulators is we have those 5 regulators across the UK, and they're sort of very similar. I would say that looking at CQC and the way they're going and the noises they're making, is that they seem to be becoming a lot more like the old CQC, if you like, before single assessment framework. I'm not sure if Georgina will agree with that, but I just the rumblings I hear. So, in terms of the Care Inspectorate Scotland and Wales, they're very much into self-evaluation, reflective practice, and really supporting their members, so their providers. So moving on from that, that's just a little bit of what we cover in the ebook. What I'm going to go through is everything in a very small way that we're covering in the ebook, obviously, because we've only got 20 minutes. So, you will have the opportunity to download the ebook, and you'll see the QR code, etc., later on in the presentation. So why compliance matters? Well, compliance isn't just a box ticking exercise. There's a lot of things that go hand in hand with compliance. So it protects clients, it protects your staff, your carers, and actually ultimately it protects your service and organisation. It ensures high quality person-centred care, as we know, and actually it really minimises risk, because what you're doing is, when you're looking at your compliance, you're looking at risk constantly. So it's reducing risk right across the service for everybody concerned. I think if your compliance is really robust, it really does improve the safety of your service. It helps with the culture. It makes the carers and your staff feel much more confident that you are in control, and therefore they are in control. And I really do think that impacts on recruitment and retention of your staff. So it does really sort of strengthen the way your care staff do feel about the service. And I think one of the big things is, and the fears is that, we're always worried about ratings and where we are with ratings, what if our rating goes down? So I think really good compliance really impacts positively on service ratings. So in terms of, you're not going to be facing enforcement, any disruption or reputational damage or risk if your compliance is absolutely top notch. In other aspects, I think looking at compliance, you're identifying areas that need to be looked at. You might be identifying areas that you're doing very, very well in. So good compliance, you're going to reduce your incidents, and therefore that will strengthen your rating and your standing within home care. So I would say, looking at compliance, sort of my strapline would be that, strong compliance drives better ratings and better outcomes right across your service. Have the next slide, please, Marie. Okay, so building on strong compliance, what I've done today is I've taken the core components of evidence collection that CQC use. These are their evidence categories. One thing I would say, as I said earlier on in the presentation, is that really self-evaluation and reflective practice is so important. And by self-evaluation, I mean looking at your service as a whole, being very honest with yourself, getting a lot of input from other people that are stakeholders within your service and outside your service, in fact, because all of those opinions and all of those people having a voice really do help you get a really good holistic picture of exactly where your service is. So CQC and actually the other regulators, they are really, really hot on gaining feedback from people's experiences. So it's not just experiences of people using the service, it's experiences of your staff, experiences of stakeholders, experiences of advocates for your clients. So you're looking at really making sure that you're getting that feedback, using that feedback for service improvement, service development, and developing your staff as well to the service needs. One thing I want to talk about a little bit about is looking at observations. Now, under the single assessment framework, observations do not take place in people's homes. And I think across the other regulators, this is the same. However, I think to elevate your service a little bit, I think it's really good that when you're doing your spot checks, your monthly spot checks, you're looking at your staff and you're observing them. And I think it's a really, really good way to say to CQC, okay, we know that you're not going to go into people's homes and observe, but we are doing that for you. So observing, making sure that your carers have looked at the care plan, you know, looking at them and saying, is this care person centered? Are the tasks that you're giving your carers person centered enough so that they really know exactly what they should be doing and they are meeting the needs of those people? This is the sort of depth that you need to go into to really sort of be able to showcase what you are doing as a service. Processes, absolutely very important, and not just having processes in place, but actually making sure that everybody knows what the processes mean. I'm a great fan of flow charts. I think if everybody has access to flow charts, they can follow those processes. I think the same with policies, looking at your policies. The staff really need to get to know some of those policies, well, all of the policies that are relevant to your service. And, you know, one of the main things about your policies is I always like to add some underpinning knowledge. So you might look at a policy and say, well, actually, what regulation goes hand in hand with this policy? What standard goes hand in hand with this policy? The other thing that I want to talk about in terms of process is, do you have a weekly meeting with your office staff? Do you have forums with your office staff? What do you do to make sure that everybody's connected and that everybody knows what they're doing? In my experience, using a Monday morning meeting I used to have at 9:30 in the morning, I'd have that Monday morning meeting. Everybody would have a coffee. We'd sit down in a relaxed atmosphere, talk about what had gone on the week before and what had happened at the weekend, say on call, and then delegate different tasks to people to make sure that they were on the ball with everything that's going on with the service, and actually that any gaps or any identified problems that are happening in the moment are dealt with absolutely immediately. One thing that I want to ask you is your annual return. So across all of the regulators, there are annual returns now. CQC calls theirs the provider information report. So what that means is that it's an ongoing, you know, live document. And what I would like you to do is think about what you do with your annual return. Are you rushing around at the last minute trying to get all of that information? Or is it a live document? And what do you do with the information that you gather from those documents? So looking at data, it's really important to be using the data and showing your regulator how you are actually improving and developing your services. So looking at assessing strengths and weaknesses, you really do need to be looking at the two fundamentals. All of the regulators across the UK are using the same sort of wording. So they're looking to see if your service is safe, effective, responsive, well-led and caring. You know, that is the essence of what social care is, isn't it? Making sure that everybody has a holistic experience, and that's including staff. The two main questions that CQC really sort of drill down on, and the other regulator, is your service well led and is your service safe? So those are the two key questions that you need to ask yourself. But you know, obviously you need to be responsive, effective and caring as well. So looking at your leadership and the key question of well led, what I've noticed is what's very apparent is that a lot of services fall down on that key question of, is your service well led? So not only do you need to be reviewing your service, you need to be reviewing your leadership, your workforce capability, evaluating your policies and procedures, your processes, your training, looking at your capacity, looking at what clients are coming in Are they becoming more complex? What do you need to do to make sure that you can cover all of these, the needs of the different complexity of care packages that home care providers are now seeing? I would also say that automating all of your processes, automate as much as possible from recruitment to care planning, to compliance. Everything should be automated because the data that you get back from that will really stand you in good stead to identify areas of improvement, identify exactly what you're doing fantastically well. And I think within that, I think it's really important, again, with the feedback, to give your staff the opportunity of a voice. One of my big things in recruitment and retention is, if you decide that you're going to employ somebody and you're going to give them that opportunity within your service, you're employing them because they have something to give to that service. So my advice would be, always give your staff a voice. It's empowering and it makes them confident and it makes them collaborative as well. So the direct benefits, you've got safety across your service, you're empowering your teams, you've got a much stronger, much robust client experience and better client outcomes. And if you're looking to scale, it's a much better platform to scale from, rather than being in a chaotic situation, which often happens. So going to the next slide. So just going to talk a very small amount about CareLineLive. So we centralize all the compliance. So the more information that you put into the system that you use, the more data that you will get out of it. So again, my advice is, when you're onboarded or when you're transitioning and doing your change management into a different type of technology, or even the technology that you're using now, do make sure that you give yourself enough time to transition so you can use that technology and get as much out of it as possible. So for example, with CareLineLive, we've got the digital rostering, so you can have a look at, your missed visits. If you have any missed visits, maybe you don't have any missed visits, but, whatever it might be, digitally rostering is going to really help you. Your incident and concern reporting, your carer app's going to help you with that. Is your care planning detailed enough? How are you scheduling your reviews? How are you managing with your EMA and medication management? And are you pulling all of the reports that you can, so that you've got all of that evidence to upload onto the portals, because that's the way it's going, regardless of whether CQC's portal's working or not at the moment. But you are going to have to use technology right across the board as time moves on. So, it's all about inspection readiness. So going back to your annual returns, I would be saying categorically, make sure that that's a live document, and make sure that you've got somebody within your service or a couple of people that are responsible for making sure that those annual returns are up to date. It's very helpful for yourselves. So moving on to auditing. So I just want to firstly talk to you about your business continuity plan. I would imagine that everybody's got a business continuity plan, especially if you do local authority work, because they will want to know that your business continuity plan is absolutely robust. So just as very basics, it's got to include communication plans, links to your local authority. I would make sure that you understand what your local authority expects and make sure that's implemented in your business continuity plan. CQC, your regulator, will want to have a look at your business continuity plan at some point. So it must include your local authority links, emergency contacts, and ensure that essential care continues under pressure. The questions I want to ask you is, and that you need to ask yourself is, are your clients ragged? You can do that on CareLineLive if you're using the system. So are your clients ragged? Who are your priority clients in an emergency? Do your staff not know what to do in an emergency? Are they well versed with what will happen in an emergency? And, you know, in general, the common risks in terms of emergency will be adverse weather conditions, IT failure, staff shortages, and public health events like the pandemic. I mean, that just threw everything into chaos, didn't it? So for most providers, at the very least. So it's really important to make sure that you know you're planning very well to avoid service disruption at all costs. In terms of mock inspections, you can do that internally. That's exactly one of the services that Georgina offers as well, to do some external mock inspections. So she will talk to you about mock inspections. I think, Georgina, I'm presuming you are. And also, we're working in partnership today with Inspired Health, which is Georgina Turner's company. And also we're going to have a look at MOA, who's one of our sister companies, after Georgina has spoken. So in terms of what's next, we've got within your the key question of well-led, sustainability in home care is absolutely huge. CQC, I'm not quite sure about the other organisations at the moment, but they are stepping back a little bit from looking at the quality question of sustainability. But that's not to say that you need to really be thinking about sustainability, not just in terms of environmental sustainability, but sustainability of your actual service. You know, what's the longevity? What's your planning for the future? So I think sort of just finally from me, I would be looking at over and above your compliance, looking at, you know, your environmental impact, your sustainability, your workforce planning and management, your workforce succession, capacity planning, financial planning for the future, and cross-sector collaboration. Because there's one thing for absolute sure, we will, well, the home care industry and tech providers like us will be definitely linking and working with the NHS services and other services outside of home care. So, you know, you really need to have that ability to scale and make sure that you've got the right technology in place. I don't know if anybody's using CareLineLive's GP Connect. That's just a great example of how we're working very hard to integrate with the NHS, slow as it is, but you know, we're really, that is at the forefront of CareLineLive's mile philosophy, if you like. So yes, looking at your ability to scale, and we have got an e-book about growing your own your care company, and lots of tips and hints about how you're going to actually scale your service, which is really important in this day and age. I'm going to leave it there. I'm going to hand over to Georgina, and thank you very much for listening to me today.
Thank you very much, Merina. I'm just going to attempt to share my slides. Won't be a second.
Just while Georgina's doing that, she's got it, that's all good. There's a link in the chat to the ebook that Merina has been referencing on compliance. I'm sure Natalie will pop a link in for the one that's about growing your home care business as well. There will be links in the email that comes to you. I'm going to get off again and leave Georgina to talk.
Hello, everybody. Good afternoon. I am delighted that IT has worked from my personal end and it's actually up and running and you can see the screen okay. So brilliant, and thank you for your time today. It's really nice to see so many people here. We know that CQC inspection, preparation, compliance is just such an important topic. So obviously my name is Georgina Turner from Inspired for Health Limited. I'm going to give you a very brief, I'm hoping you can still see me okay. Just double checking because I can't see you anymore. Can if you don't mind, just letting me know. Merina, can you hear me?
Yeah, all good. We can see the
Yes,
screen.
we can hear you.
Fabulous. Mind of its own, my computer really has. But the good thing, as long as you can see my screen and you can hear me, I'm happy. Okay, so basically, without boring you too much, I've worked in adult social care on and off since I was 14. So I started off working in care homes, domiciliary care. In care homes, it was doing the dishes, ironing, all that sort of thing, and then gradually went up to be a care assistant. I then did my nursing and worked in all aspects of like acute medicine, district nursing, private nursing, etc. And looking after children on ventilators in their own home for a little while. I then did my law degree and law masters, and I was in the NHS management and quality and good governance sort of side for a very long time, over 20 years. And part of my role was as an internal auditor for most of the Northwest hospitals, and that was for about 11 years. During that time, I also worked for the CQC as a specialist professional advisor, specifically focusing on good governance, audit, excuse me, care planning and medicines management. So I'm giving you this information because when you've got questions at the end, if I can help you, I certainly will do. If I can't, I'm sure one of CareLineLive's team will be able to help you. So, we do obviously welcome questions on this topic. I know getting ready for inspection is always stressful, and for me, I'm totally biased. Good governance for me and safe, as Marina said, extremely important. Like all the 5 key questions are important, but we want to make sure that we get these very much right, because we know that anything that affects our safe will ultimately affect our well-led rating. Not always, but most of the time. So we need to make sure we can get it right as best as we can. So today I'm going to be giving you some general top tips for inspection. Now, you'll be very glad to know that it's only a short session from me. Sometimes I have to do webinars like this, and they could be like 6 hours, but usually they're in a nice hotel with coffee and cake, so it's a bit different. So hopefully you've got a nice strong coffee for this next part of the session. Okay, so for me, the first thing I just wanted to quickly talk you through, but it is going to be quick, is the single assessment framework. I'm sure everyone has been studying this, or you're aware that there's lots going on over the past couple of years. I know I've been teaching it for several years, and of course now we have the CQC consultation, which is going to end on the 11th of December. And so the process that we have in place now will change, but we can't get too excited yet, because it's probably going to not be, I reckon, at least a year. I don't know. I don't work for the CQC anymore in that respect, because the criteria for the specialist professional advisors changed last year. So basically, as Marina mentioned, it sounds like we sort of might be going back a little bit. So we'll be having separate frameworks again. We are going to be having the equivalent of rating characteristics again. So those of you who were used to the key lines of inquiry document, which was a helpful document but quite vast, we know that that changed, and that went, and we had the quality statements made up of I and we statements. So the we statements being, do we, the provider, agree with the statement on safe, for example? And then I statement is more from the patient, the service user's point of view. Do I feel respected? Do I get my medications on time? So when it comes to the single assessment framework, we are still going to have to focus on this for now. I think it's very advisable to join any consultation events, get involved. I know there's been some emails out recently by the CQC asking people to come and attend in person, I think in London. So that would be interesting if you can get a place on that. But just remember, for me, the 5 key questions: are we safe, caring, effective, responsive, well-led? They're still there, they're not going anywhere. And the most important thing from me, and I've been talking about this forever since I've been doing my mock inspections with clients, is that the registered manager especially, and the nominated individual, but the registered manager is legally responsible for meeting the CQC regulations. So my tip to everyone is to focus on that. And if you are doing sort of internal mock inspections or peer review work yourselves, then it would make sense to look obviously at the single assessment framework and the quality statements, but be very mindful that the regulations are not changing, and I've always used that for my mock inspections as a tool to assess compliance, because for me personally it makes more sense. So for any of you who've not had time to read the regulations, because I know if you mention law, a lot of people think, oh my goodness, it's definitely worth reading them because they make perfect sense. And as Marina mentioned earlier, a lot of the policies, procedures, and the work you do, in fact, all of it is relevant to a regulation. And the more you upskill your team members and point out that, okay, we're looking at recruitment today. So that's Regulation 19, fit and proper person employed, for example, or we're looking at medicines management today. That's Regulation 12, safe care and treatment. The more we educate our teams, the easier it will be for them, and it'll be very helpful when you're working with local authorities as well. So that's a single assessment framework. So it's basically watch this space and get involved. Okay. So for me, as I said before, I'm very focused on good governance, and one of my roles within the NHS and in the private work for Inspired for Health is helping companies get their governance structures and their auditing in place, because it's so important. And it was an area that I specifically focused on with the CQC within adult social care. So I did a lot of inspections with them as the specialist professional advisor, so working in partnership with the lead inspector, and then of course with our own mock inspections that we do virtually and on site, whatever suits the client. Okay, so I'm just going to talk about auditing, and I know you've got the benchmarking team is going to be talking to you about that later on. But for now, just a few little tips from me, because I spent 10, 11 years in auditing, and even though it was in the NHS, it did teach me a lot. And so one thing I want to make sure people always remember, it is audit comes under Regulation 17, good governance. And for me, it is such an important topic. It protects your service users, it protects you as a company, and it makes sure that you are quality checking and consistently improving the quality of your care. So auditing is incredibly important, it really is, and you must always make sure you have the right tool for the job when it comes to auditing. So for me, we know that we have to audit, and the CQC and Regulation 17 make it very clear that we have to conduct regular audits on the CQC regulations. So if you go back to basics and you look at the regulations, I think it's 4 to 20A, then you will see the areas we have to audit against. So it could be, consent, medicines management, infection prevention and control, recruitment, complaints. It matches the regulations. So that's why I always tell everybody, revisit them, go back to basics. They are so much easier. And as we know, we don't know what's happening in the single assessment framework, but the regulations are not changing. So it's a very good start, really important. Okay, so going back to the slide then, for me, it really does help providers understand their strengths and weaknesses. And some people, when you talk about audit, they think, oh, I don't really want to go there. For an example could be you need to look at the timeliness of medication administration in comparison with the care plan, the medication care plan that's put in place. And one thing I did notice when I was using CareLineLive, because I do a lot of audits for companies, some people, they will do the audits and I'll check them, or for some people, they'll ask our team to do the audits and feedback to them. And CareLineLive has a really good MAR chart. I hope you didn't mind me saying this, everyone, at CareLineLive. And that's what drew me to them, because it was so straightforward, where when I do my mock inspections or my previous CQC inspections, I would look at some systems for medicines management and they'd be quite overwhelming. So I do highly recommend CareLineLive's medication system. Okay, so for me, having a annual audit schedule, a really clear plan in place for when you're going to audit, what you're going to audit, who's going to audit, is going to really help you test your strengths and weaknesses. So as I was talking about before, when it comes to things like medicines management and, for example, timeliness of medications, people sometimes think, oh gosh, I don't really want to know because I bet there's all sorts of problems, but it's much better that you have a good audit tool and you check things like that, looking at their daily logs, looking at the medication care plan, and looking at the MAR charts to make sure that if there are any problems, any weaknesses in the work that we are doing, that we can actually rectify them and learn from them. Because the CQC know, we're human, mistakes happen. We don't want them to happen, but no matter what we do and how much we try and mitigate risks, there's always going to be human error. So audit is another way of protecting us. It helps us provide safer care. And for me, it also helps us test things like our training, because if we are asking our staff to, say, for example, to fill out a daily log, and we're asking them to put a good level of detail in there, and then we test them via audit, and then we sort of say, oh, that wasn't very good, you didn't write that properly, it wasn't very clear. We also have to go back then to our training at induction. What do we teach them on that particular topic? Do we give them very clear examples of good and poor practice so they can learn from them? Do we discuss it at supervision? So there's a lot of things that audit can do to help us, and I do separate audit training sessions on Eventbrite if anyone obviously wants to look at them, and they are on the Inspired for Health site within Eventbrite. So carrying on. More tips, how can we prepare? So there is so much that we can do to get ready for an inspection, and in an ideal magical world we want it to be business as usual. So CQC contact us, they could give us 48 hours, they could give us 24 hours, they could just turn up, they might just give us an hour. We don't know. That's what can be frustrating. But in an ideal magical world we'd think that's fine. They're coming, everything's ready because we've prepared for this and we've prepared our staff. And so for me, it's really, really important to prepare our staff. Our frontline staff, they don't need to know all the elements of everything to do with CQC compliance, but they do need to know who the CQC are, what sort of questions they may ask us. They need to know that we want to demonstrate how proud we are of our service and how much we value our service users. We want to make sure the CQC know the positive outcomes that we have contributed to help our service users thrive when they're in their own home. So the more we can sort of get our staff and our teams involved in CQC compliance at different levels, depending on their role, the better. For me, it's going to be good. We want to upskill our staff because happy, informed staff are more likely to stay. So that's what we really want to do. So for me, I always put test yourselves ready for inspection. So of course, if you've got internal peer review and you've got tools to do that, absolutely brilliant. But if you want an objective third party, obviously I'm going to say like Inspired for Health or another mock inspection provider, it's really good to do that because then you'll get an objective idea of where you're at the moment and recommendations for improvement, but in a nice, safe, supportive environment. And it's better to have that and then be ready and have an action plan. And then if CQC suddenly come and you think, oh, we didn't get that done in time, but we've got an action plan showing we've already recognised we have areas to strengthen, but we've got a clear plan how we're going to do that. And that makes a big difference. It's about learning and actioning and constantly, reflecting on our practice, obviously, which I've put on the slide here. Excuse me. So for me, attending forums, networking events, keeping up to date is always going to be key. And so the fact that you're here today is excellent. One tip you should do, if you haven't already done it, you may be much more organised than me, is write down every webinar you attend on a spreadsheet, Word document, whatever, because as a nurse, I have to revalidate regularly, and going back over 3 years to write down all the webinars I've attended or training courses I've done was painful. So that taught me that I should be doing it ongoing. It's also really helpful because you can then demonstrate to the CQC how you as a registered manager or the nominated individual, etc., is keeping up to date and that you are proactive and you're not just stagnant, that you're constantly working to improve the quality. Because as I've put on the slide, continuous quality improvement is our goal. We know that what was outstanding, last year might not be outstanding now, because then that could be good because everyone has sort of upped their game and got to that goal. So subscribe to mailing lists, very important to get the information from the CQC as well. I'm sure a lot of you are subscribed to the CQC's mailing list, but a lot of people aren't, and you do need their information. And a tip for you, go right to the bottom of their emails, because sometimes they'll have the main things that are really important, but then recently I found some really interesting things at the bottom of the emails. Like I won't bore you with this now, but there was a section on constipation care plans, and I was thinking, I didn't know about this. And then it was a link and it was really informative, and I was able to support my clients to strengthen some of their care plan processes. So for me, as I've mentioned, testing yourselves consistently and regularly is going to really, really help you. And I know sometimes you're so busy just doing the day-to-day work that it is hard. And that's why getting external company to support you, technical experts to support you, is good. It's not seen as a sign of weakness. In Regulation 17, it specifically mentions getting the support of external experts to help you, which is a good thing. So it's never seen as a problem. It's always seen as a positive to get someone objective to come in and look at your service, either on-site or virtually. Very quickly, because I'm conscious of the time, evidence collection, evidence collation for the single assessment framework as it stands now. So for me, there's lots of different things that we can do. People have different ways of collecting their evidence. I personally am not a fan of having 34 files when it comes to of having evidence for the quality statements, because we know not everyone is going to be asked, and also it's very, very repetitive at the moment. So you might find that you've got audit reports, team minutes of meetings, and they might be in several different files, and that's hard to keep a track on and hard to have version control. But make sure that you're starting to look at things like the regulations, starting to log evidence, that you do discuss the quality statements now within your teams, and thinking, looking at the quality we statements and thinking, if we are pitched as at good, which is what they are pitched at, would we agree with those quality statements? And what evidence would we submit to the CQC if they turned up at our doorstep now, or they asked us in advance to send it through? So preparation is key. So I'll be quick. So there's lots of different areas of interest, and as you can imagine, I can talk for England about this topic. So for me, things like emollients, the use of topical medication. Time and time again, I keep going into clients and noticing that they haven't got risk assessments when it comes to flammable topical medications. So if you haven't already got them in place, extremely important, as there sadly has been fatalities. Have a look into the constipation care plans, because sadly enough there has been fatalities. I can't remember the drug that they had been linked to for fecal impaction, and that's why they're so important. Possibly clozapine, but please don't quote me on that. But it's important to have a look at these key risk areas, and talking to your peers, especially ones that have had CQC inspections recently, they'll be able to tell you areas of importance, areas that they focused on. And by reading CQC reports, make sure you read inadequate ones, not just good ones. You'll be able to see what you can learn from them, because I think that's important too. So When it comes to audits, we've already talked about that. Audits are definitely going to be a key area of interest because it is an area that people struggle with the most. And as I said, Regulation 17, well led, can be affected by your safe element. So if you haven't got a really good safe process of medicines administration, it might be the case that that could affect your well led rating. Very important that you all attend autism and learning disability awareness training, Oliver McGowan training or equivalent. I won't go into that now, but that is a hot, important topic. And for those who are registered with learning disability, autism, please make sure you've read Right Support, Right Care, Right Culture. Extremely important. Now, very quickly before I finish, importance of innovation. Now, for me, it is really important to try and think outside the box. It makes perfect sense for you to, as Marina mentioned, value your staff, ask for their opinion. What can we do differently? What ideas do they have? Can we take positive risks? Because the CQC do like positive risk taking, obviously with consent, risk assessments, etc. And some ideas I've seen recently, which have been amazing. One care home, that I was with a while ago, they worked with universities to develop different sort of technology to support safe care and support in care homes, which was amazing. Some services that I work with, they go into universities or colleges studying health and social care, and they might give them a talk on the day in the life of a care worker, support worker, registered manager, and you're giving something back to the community because the big community focus when the CQC look at the single assessment framework. But you may also encourage people to come into the sector, and you're being innovative, you are thinking differently, you are always looking for new ways to tell people how proud of the work that you're doing, because we know that all of you work extremely hard. So there's so many ideas, and I do separate talks about innovation and outstanding in CQC compliance. But sadly, not enough time for that today. But if we can help you in any way, obviously, please get in touch with us. We're a very friendly team. And thank you very much for your time. I will be passing you back on. And just before I do that, there will be a slide in your pack about a new service we are offering within Inspired for Health called Inspired for Health Coaching to support people when it comes to stress reduction in adult social care, because we know you all work extremely hard. So thank you very much for listening. I hope it's been helpful, and we look forward to your questions. And I'm hoping I can stop sharing this properly.
Thank you very much, Georgina.
Oh, it's worked.
Yep, awesome. It's all gone well. I'm going to go straight over to Dave from MOA. Dave, I'm not going to share the screen that I had of your notes. I'm just going to hand it straight over to you to do whatever you would like.
No problem. Thank you, Mary. Good afternoon, everybody. Thank you once again for all jumping onto the session. I just wanted to spend a very small amount of time talking a bit about what we do at MOA Benchmarking and how it keys into the bits and pieces that Marina and Georgina have been talking about this afternoon. For really brief context, and in the interest of not making this a sales pitch, just for anybody who's unaware of what MOA do, so we are a online compliance and quality management and self-assessment and continuous improvement platform for the adult social care space. So we provide a suite of tools via that online system for monitoring and self-assessing your compliance against the CQC single assessment framework, and in time, whatever the single assessment framework will be kind of phased out with and replaced with in the coming year or so. And we provide that service largely through a suite of audit tools and other related surveys and reporting platforms through the system. A lot of this keys in really well with some of the things that Georgina has been speaking about in terms of your auditing approach and evidence collation and having that information available to you. Having an ongoing system that allows you to conduct that self-assessment and allows you to, over time, collect that evidence and monitor your performance, and allows you to, on demand, have access to information about what your performance is like and what your relatedly what your continuous improvement initiatives and things of that nature are is really important in that process. So the approach that we take with the MOA product is that we have a team of content specialists that we work with, whose whole role is around reviewing the tools that we provide against the single assessment framework and against shifts in regulation and legislation and best practice over time, and making sure that the system that we're providing and the tools that we're providing through that system remain up to date. So that's obviously valuable on an ongoing basis, but particularly as the framework and the CQC standards are rearranged to reintroduce the characteristics and things akin to the old key lines of inquiry, which were replaced with the key questions. This program that we provide through the system will work to update that so that it's reflecting those new standards, and so that the providers we work with who are using the system don't have any of that kind of administrative overhead or burden in maintaining the system itself. The tools will just be updated automatically for them. That approach that we take, again, it's very much aligned with the process that Georgina has been advocating for, where we have kind of an annual program of audits and we isolate which kind of particular areas of the single assessment framework we're going to review and assess month to month. And then a little bit relatedly to what Merina was speaking about too, in terms of evaluating your broader processes and leadership around those areas. So the auditing that we do with the providers we work with is extends beyond things like just reviewing your care plans and making sure that, you know, that medications are being administered in the appropriate timings, and that the care and service that's being delivered is consistent with the care plans, that it evaluates those broader structures and governance processes around those. So that's all achieved by administering the audits through that online platform. They all sit alongside the various different survey tools that we provide in the system as well. So again, as Merina and Georgina were talking about earlier, that auditing process and that self-assessment process is valuable, but the voice of your clients and the voice of your staff is also critical in that as well. So off the shelf alongside these audits, the providers we work with have access to various different survey tools that focus on different elements of the assessment framework and the key questions, as well as some broader assessment tools. And then those audit tools themselves, the structure of those reflects kind of a contemporary approach to quality is how we would describe it. So a multi-lensed, kind of multifaceted approach to that assessment. So not just looking at the actual practice and care and service delivery that's happening at the coalface with your clients and with your staff, but again, examining those broader systems and policies and procedures that are around them. So we provide guidance on the types of evidence you should be able to produce and the things that you should be able to demonstrate that you're doing within each of these areas, and the stuff that you should be able to produce to the CQC at inspection time. So that's all guided through those questions in the audit tools themselves and through the further support and guidance materials that we offer in the system too. All that's in our solution is mapped against those quality statements and against the standards and regulations as well. And where that becomes probably most powerful is where that flows through to the higher level reporting that is available in the system. So again, this is just one of those ways that you can have all of that data immediately available to you and have that information on tap. So all of that auditing that we're doing through that annual schedule of tools, that rolls up into these high-level results here, where we can see overall how we're performing on each of the quality statements, and pretty importantly too, what our performance is like against the broader sector and against other comparable providers. So at MOA, we're very fortunate to have a team of academics and epidemiologists and data scientists whose research area is all specifically in evaluating quality of care systems. And we're able to put together some models that look at the performance of the providers that we have and extrapolate that out to give a broader indication of industry performance in each of these areas. So we might conduct an audit on a particular topic, and we would be able to identify what our performance sort of looks like in absolute terms. But that external reference point against the rest of the sector and other comparable providers is important in helping us identify, more broadly where we sit. And then all of that reporting that's provided allows you to kind of drill down into those individual quality statements, also to look at the mapping against the standards and regulations as well, and to look at, in terms of your evidence base, what the assessments and audits are that we've conducted in the past year that have given us this result, and where the riskier data sits, and how heavily those results are weighted in our overall performance too. And then Georgina was speaking as well around your continuous improvement and the importance of that and your sort of reflective practice. And it's important not just to have these data there for their own sake, but to be able to use that to guide your practice and guide your continuous improvement and actually do something with that information. So the system that we work with our providers, again, allows you to have a look at all of the things that you're actually identifying through that auditing process, identify where the opportunities for improvement lie and what the things are that you might be able to do to improve, and then have those logged against continuous improvement actions and quality initiatives within your service as well. So again, from the perspective of having a service that's well led and well governed, you've got this evidence base of not just that auditing you've done, but all of the things you've identified through those self-assessment processes and what it is that you're doing to work on those and in response to those, and has that evidence there again for CQC at inspection, so that they can see, not just that you've got those processes in place, but they're valuable to you in terms of improving your quality of service. So I don't want to, as I said, spend too much time giving you something that's a little bit dangerously close to a sales pitch on this product, but we work very closely with CareLineLive for any providers that are currently using that system. We have integrations directly into that platform, and those are continuing to be fleshed out as well to streamline that data collection process and that data entry process. And ultimately, that use of these sorts of tools allow you to have a really robust system in place that has all of that evidence that's collated for you and allows you to, in a regular kind of periodic fashion, review what you're doing against the standards and review your performance, and not have it, when you get the call from the CQC to expect your inspection, not have it be a mad rush to collate all of that evidence and put everything together, and have a really, well-bedded and well-governed process in place. So yeah, that's really all that I wanted to speak to from the MOA perspective today. I'm mindful of time as well. If anybody does want to get in touch with us to have a bit more of a chat, you're welcome to contact whomever you would usually reach out to within CareLineLive if you're a CareLineLive client, and they can put you onto us directly. We'll also circulate our direct contact details in the follow-up to this session as well. But yeah, I'll hand you back over to Marie. Thank you very much.
Thank you very much for that. Okay, so there's no questions in the chat threads at the moment. Now is your opportunity to ask any compliance-related questions that you have, if you would like. Otherwise, we will wrap the meeting up. I'm sure all of our speakers would be quite happy to, be contacted directly on LinkedIn if you have additional questions about what they offer. Excuse me. Right, I don't think there are any questions, so I think we'll wrap this up now. Thank you very much, Merina, Georgina and David, and we will, as I say, be sending you the recording of this and the various slide decks out on email over the next couple of days. Thank you very much. Oh, Natalie has reminded me by putting in the threads. If you've enjoyed this webinar and found it helpful, we would love for you to write a review on our Trustpilot page. One of our things at CareLineLive is that we are really well rated on Trustpilot for not just the product we have, but our customer support, but also some of the other bits and pieces we do, such as these webinars. And if you could find 2 minutes just to click through on that and say, really enjoyed the webinar, thank you, 5 stars, we would be extremely happy. So little grovel there from me. I am going to end the event now. Thank you very much.